All right, this chapter is going to be talking about toxicology. Um, there's some standard competencies there. All right, we're going to be recognizing toxicology, carbon monoxide poisonings, nerve agent poisonings, how to when to contact poison control, and different things such as inhaled poisons, ingested poisons, injected poisons, absorbed poisons, alcohol intoxication, and opiate toxidromes. So we'll talk about each one of these, and as we get towards the end, a lot of your treatment is going to be the same. It's going to be supportive for a lot of these things. We'll talk about some different medications to give to certain overdoses. So I'm going to talk about signs and symptoms, and then just say there's supportive measures. So supportive measures basically is going to mean you're going to maintain an open airway, administer high flow to if needed, or oxygen supplement if needed, establish your IV access. If it's a situation that the patient needs to be controlled, then you need to go ahead and call for your paramedic backup so that they can give some medication, some benzodiazepines, Ativan, Versed, to these patients to calm them down. So there's legal drugs out there, alcohol and oxycodone, and then there's illegal drugs, illicit drugs such as heroin and ecstasy. All right, a poison is a toxin by nature. A drug can have some therapeutic effect if given in appropriate circumstances and dose. Overdoses are a toxicologic emergency. So sometimes these patients are in a state that 911 needs to be initiated, and we need to get there to give a purpose. So toxicology is the study of toxin or poisonous substance. Toxicological emergency may be intentional. Poisoning in adults is commonly intentional, and suicide is often accomplished with the use of drugs. It may be unintentional, such as medication dosing errors, and childhood poisonings are common, but a lot of times they're unintentional. So especially geriatric patients in the medication dosing errors, the doctors give these patients the correct dosage, what they think. However, as you age, your body does not secrete these medications as quick as possible. So a lot of times, they overdose on them unintentionally. Sometimes these patients forget to take their medicine, and sometimes they go and they take two doses at the same time, not understanding that they only need to take that one dose. So, some of them can be found in nature, such as wild mushrooms. A lot of times, some of them can be found in the workplace. And maybe some asbestos, and you develop cancers and different things like that. So it may be unintentional, such as the result of neglect or oversight. You have chemical and biological warfare that can cause emergencies also to a large group of people. Intentional poisonings or overdose may occur during crimes, such as the date rape drugs used to facilitate, sexual assault, the knockout drops used to commit assault, and then pharmacological agents are also used in homicides. So don't ever hesitate to contact poison control. There's the number for them, so they can give you some information on ingestions, its toxic properties, and steps to negate its effects. So access to information about all commonly used medications, chemicals, and substances may be poisonous. So but when you call that number, be prepared to answer a few simple questions first. Age, possible what they've taken, and a possible dosage. And some signs and symptoms that they are showing at that time. So don't call them before you get to the patient themselves. Just based off of CAD data or before you've actually done a complete assessment. Do your assessment and then call them. and get some more information. They're also going to ask you where you transport it to, and the reason being they can go ahead and call that receiving facility and give them a heads up with what's coming in also. All right. There's 4 different main ways. Ingestion, of course, is swallowing. So, and we'll talk about each one of these individually, but each one of these are unique in how the toxins are absorbed into the body, and each one of those will take a different amount of time to metabolize that toxin itself. So, ingestion is most common. Swallowing the toxin itself. So a lot of times it's medications around the home or household chemicals. Be careful with those household chemicals and how they're labeled. I always give the example. My father actually put a chemical to store it. In several different places. He used to use a Betty Crocker bowl, and my sister got a hold of it one day, opened it up, and didn't realize what it was, and that caused some problems that day for her. But and that was just a mistake. He was storing a small amount and somewhere different. That way he had easier access to it. And I'm pretty sure he thought it was up and out of the way. And as we grow older, we get kind of curious and different things like that. So it may produce immediate damage to tissues or effects that may be delayed for several hours. Indicators: plant will partially chew your leaves or missing berries, staining fingers, lips, or tongue, empty pill bottles. From a recently filled prescription. Patient complaining of sudden onset of stomach cramps and are without nausea, vomiting, or diarrhea. We use Serp-Evcat. It's recommended only in a few situations. Some EMS systems do carry the activated charcoal. Activated charcoal is an oil suspension that binds to the poison, and it carries it out of the system with nausea, vomiting, or through diarrhea, through the feces and fecal matter. So the only bad thing about it was, your patient had to be alert, had to be able to swallow, kind of like oil glucose is. So, any kind of deterrence in these two things, you did not administer this drug. And it also induces vomiting. It binds to the toxin itself and carries it out. So this induction of vomiting would cause aspiration sometimes. So that was one negative thing about this drug. They still do use it in the hospital a lot of times, depending on the situation. However, if you're around it and you're seeing it being used, be careful when they vomit this drug out. It causes a dark charcoal to actually come out, and it will stain. All right, poisons by inhalation, home medications, household chemical products. A lot of times people mix up cleaning products, and they don't realize when they mix it up, it causes a chemical reaction. It causes a plume of smoke. So do not enter that hazardous environment. You need to call for special resources that have protective airway equipment, such as self-contained breathing apparatus. Your local fire department should have that. Hazmat crews, responders will have that also. So you may need them to come to the scene to actually, extricate your patient. So inhaled toxins quickly reach the alveoli, to the respiratory tract, and then they instantly gone through circulation. So you have a rapid onset of signs and symptoms, and the window of opportunity of treatment is sometimes limited. First consideration is vaccine safety. Call for hazmat, call for people with SCBAs if you need to extricate that patient out of that environment. Take off the patient's clothing. You may have many different signs and symptoms depending on the toxin itself. So take containers, bottles, or labels from the toxic substance with you also. Sometimes these patients are doing this to try to commit suicide. So there may be a person sitting inside of a vehicle with the engine running inside of a closed garage, as an example. So there has been some variations with the use of automobiles, and it's called chemical suicide, and it involves people using a tightly sealed vehicle as a toxic gas chamber. So tape or sealed windows, locked doors, posted warning signs, a suicide note, all empty chemical containers, or a unusual odor is a sign that this is a suicide attempt. So please be careful when you're trying to extricate these patients quickly. Sometimes we get the narrow tunnel vision, and we don't think about once we break open the window or something like that those students are actually going to escape out of that car, and it may cause responders problems too. Calls for hazmat, calls for resources that not have SCBAs available. So treat the hypoxia and get your IV access and call for paramedic backup if needed. All right, poison by injection, usually resort to drug abuse. Side effects can vary greatly. So remove the absorbed. Correction. In general, injecting the poisons are impossible to delete or remove, so quickly absorbed into the body and causing intense local tissue destruction. So, supportive care is what you're going to do. Be alert for nausea and vomiting. Try to remove jewelry from the areas from the injection site, and take all containers, bottles, labels with you if you have them at the hospital. Most poisons by absorption. Most serious absorption poisons are pesticides. So these are organic phosphates, and they are serious. So corrosive substances through the skin, mucous membranes, and the eyes. Other substances are absorbed into the bloodstream through the skin, may have and have systemic effects. So they distinguish between contact burns and contact absorption. So signs and symptoms may depend on the history of the exposure, the liquid or the powder on the patient's skin, the burns, itching, irritation, skin discoloration, the odors typically of the substance. So avoid trying to contaminate others or yourself. Remove irritating or corrosive substances from the patient as quick as possible. Cut off all the clothing that has been contaminated. Never pull clothing over the patient's head. The powder or the substance itself may come down on the patient and go through orifices such as the eyes, the ears, and the nose and the mouth. You should never flush off a dry powder. That could cause a chemical reaction itself. Dry it off thoroughly first, and brush it off, and then flush it with running water, and then use soap and water also. If it is a large amount of material that has been spilled, you need to flush it for at least 20 minutes, and this can be done en route to the hospital also. So many chemical burns occur in industrial settings. Trained people will usually be there to assist you. So do not try to neutralize the substance with other chemicals. Brush it off as much as possible. If it is a solid, then immediately wash it off the substance with plenty of water. Try to take those MSDS sheets with you and transport with the patient. And irrigate en route to the patient, en route to the receiving facility. So industrial facilities and plants and different things like that, they do know what the antidote is, and they can administer that at times. It may be a drug that you are not familiar with, as far as your local EMS system and policies and protocols. So these patients, these workers may have to go with you on the ambulance also. So a lot of these sites do have trained personnel and hazmat incidents that respond due to the chemicals that they actually have on site. All right, many drugs, as far as toxidromes, are similar signs and symptoms of the poisonous agent itself. So major toxidromes such as stimulant narcotics and pathomimetics, sedatives and hypnotics, cholinergics and anticholinergics. All right, things size up. For all toxicological emergencies, do determine your nature of the illness, mechanism of the injury. How many number of patients do you have? You have a bunch of patients complaining the same thing. Be prepared for that chemical warfare or a hazmat situation that may be that may be intentional in purpose. Call for additional resources as you need them, and whether or not you need spinal mobilize is required. You may have a trauma patient along with the overdose also. Just an example is, you sometimes in the summertime, you have these people that jump off of piers and diving boards, and they've also been consuming alcoholic beverages, and they may be walking around with neck pain, due to jumping off into the water somewhere. Always wear your appropriate PPE, and always try to remember that patients may be dangerous. So look for clues at this thing, such as medication bottles, alcoholic beverages containers, syringes, or other drug paraphernalia, unpleasant or odd odor, and presence of a drug laboratory, like what you got in this picture here. So with your primary survey, do not be fooled into thinking that a responsible alert only the patient is in stable condition. Identifying your life threats with your ABCDEs. Ensure that the patient has an open airway and adequate ventilation. Always check circulatory status, assess the pulse and skin condition, check for bleeding, alterations in the ABC or poor general impression or indications for immediate transport. A delay on the scene is rarely indicated, and consider decontamination of the patient before transport, depending on the poison that the patient was exposed to. Always try to get good history with our PQRST. If your patient is responsive, begin with an evaluation of the exposure and a sample history. For unresponsive patients, attempt to obtain the history from other sources, such as friends, family members, medical identification jewelry, and cards and wallets. With your sample, you need to ask what was the agent, when was it ingested, ejected, absorbed, or inhaled, how much if possible was taken, what else was taken if it was a toxic job, over what kind of period. Sometimes especially with alcohol consumption, it could happen over a period of weeks. So has there any kind of intervention being performed? Is there any kind of antidote being administered? Has the patient vomited or aspirated? How much does the patient weigh? And what kind of substance was taken? In your secondary complaint, focus on the area of the body that was involved in the poisoning or the route of exposure. Get your vital signs of pulse, and look for alterations in the level of consciousness, pulse, respiration, blood pressure, and skin. So in your reassessment, go through your ABCDEs, evaluate the effectiveness of the interventions you've done so far. Repeat assessment of vital signs, 5 minutes for unstable and 15 minutes for stable. So depending on your treatments, kind of depend on what the patient was exposed to or how he or she was exposed. Support your ABCs is the most important thing, and dilute airborne exposures with oxygen. A lot of times you can just do that by getting them out of the environment itself. Remove contact exposures with copious amounts of water unless contraindicated. Consider activated charcoal for ingested poisoning, and contact medical control or the poison control center to discuss treatment options. Once your primary survey and history taken and secondary assessment are complete, contact medical control if needed. Report as much information as you can about the poison or chemical to the hospital. And if the safety data sheet is merely available, take it with you to the hospital. Always ensure you're seeing safety with this patient. You may have an overdose patient that has a psych emergency also, and they may be, violent towards you as the responder. So, if you need to remove yourself from that situation, you have to. So, perform external decontamination needed. Remove tablets and fragments from the patient's mouth. However, be careful, make sure that they're not going to bite your fingers off, and wash or brush the poison from the patient's skin. Assess and maintain ABCs, provide oxygen, and perform assisted ventilation if necessary. Treat for signs and symptoms of shock, and if approved by medical control, get activated charcoal. Activated charcoal is not indicated for patients who have ingested an acid, an alkaline, or petroleum product, have a decreased level of consciousness and cannot protect their own airway, or if they're unable to swallow. Its dosage is usually 1 gram of activated charcoal per kilogram of body weight. So for adults, that's usually 25 to 50 grams, or 12.5 to 25 grams for children. Some side effects: black stools, nausea, vomiting, and possible airway problems due to aspiration after vomiting. All right, alcohol is the most widely abused in the U.S. It's a state of physical and psychological addiction. Alcohol tends to have chronic malnutrition and fall frequently with it too. So you may have that trauma consideration. It does depress the CNS system, the central nervous system, so it decreases activity and excitement, induces sleep, and it dulls the sense of awareness. It slows your reflexes and reduces reaction time. So it causes aggressive and inappropriate behavior with some patients and a lack of coordination. So you may have head trauma, you may have trauma in general with the alcoholism. I've been in plenty of places that have been on a binge, and I had a patient one time that had been on an alcoholic binge and had a femur fracture, and it was an old femur fracture, and it was obviously a fracture. Toxic reactions, uncontrolled diabetes. Always check your sugar with these patients with the amount of sugar that alcohol does contain. Death from respiratory depression and/or aspiration of vomiting and stomach contents. Physical dependence and/or withdrawal, hepatitis, and cirrhosis are also some long-term effects of alcohol abuse. So you may also have erosive gastritis, increased risk of breast and colon rectal cancer. Bleeding if the patient is unresponsive, also, or vomiting blood. All right, narcotics. It produces sleep or autonomic status. Opiates are natural drugs derived from opium. An opioid is a non-opium derived synthetic. So some examples are morphine, cocaine, heroin, fentanyl, oxycodone, and the other three. Opioids bind with receptor sites in the brain and other tissues. It can be absorbed through the GI tract, nasal mucosa, and the lungs. So when heroin passes through the liver, it continues to exert narcotic effects that may outlast the effects of Narcan. So morphine and heroin produce an impressive dream-like state. So 9 out of 10 times, these patients are going to be sleepy in nature, in a coma at best, and we'll talk about that some more. So it uses euphoria, causes many different side effects, sleepiness, drowsiness. So the reversal of this and the treatment is Narcan, naloxone. It reverses the effects. Its dosage is 0.4 to 2 milligrams, and it can be administered IV, IM, or intranasally. So it may precipitate withdrawal syndromes resulting in violent behavior or seizure-like activity. So this is a drug that should only be used when there's agonal respirations or even apnea. Okay, you're going to reverse the agonal respirations and the respiratory compromise that's going on with the narcotic overdose itself. If this patient's are breathing normally, even with autoimmune status, but their breathing status is normal, please don't use Narcan. This drug is going to give a reverse of the narcotic side effects. A lot of these patients will come up and become alert oriented, and a lot of them do get irritated and agitated. So when giving this drug, also please give it slowly. You may want to start with 0.5 milligram and go up to 2 milligrams. So if the illicit drugs are on the scene itself, you may want to involve law enforcement also. All right, stimulants swallowed, smoked, or IV injected. First time use can become addicted within a few days. So once addicted, quitting is extremely difficult and highly unlikely. So it will cause excitement, delirium, tachycardia, hypertension with a fast pulse, dilated pupils. Also with the narcotics, opiates, opioids, you're gonna have the constricted pupils. Also, so that's another sign of that overdose. Psychosis with stimulants, also with when toxic levels are reached, tremor, seizures, or even possible cardiac arrest. All right, cocaine is naturally occurring alkaloid that is extracted from cocoa plant. It's got straight names such as blow, flake, lady, nose candy, snow tube. Um, it can be applied topically, swallowed, snorted, or injected intravenously. It may be mixed with baking soda or water, such as crack cocaine. So when snorted, it is usually felt within 1 to 2 minutes. When smoked, the effects are 8 to 10 seconds. It's abuse terms. Drug abuse is any drug that causes physical, psychological, economic, legal, or social harm to the user or other affected by the drug user's behavior. Habituation is psychological dependence on the drug. Physical dependence is a psychological state of addiction to a drug, usually characterized by tolerance to the drug's effects and a withdrawal syndrome if the drug is stopped, especially if it's stopped abruptly. Psychological dependence is emotional state of craving a drug to maintain a feeling of well-being. Treatment for stimulants, maintain O2 saturation level, try to prevent seizure activity with appropriate sedation with benzodiazepines. Monitor your vital signs and get that IV action. Call for paramedics. All right, marijuana and cannabis compounds usually smoke with effects in minutes. Smoking marijuana results in bronchodilation, slight tachycardia, and you get that euphoria of androgynous, that diminished motor coordination and bloodshot eyes. And a lot of times, this stuff is called weed, pot, dope, or smoke on the street. That may be some of the street names. So just supportive in nature as far as care. Spice is a blend of synthetic cannabinoids. It can cause psychosis, hallucinations, and we're just going to treat. Also, these things are showing up in the e-cigarettes too. All right, hallucinogens, all the sensory perceptions, such as LSD, can last for a very long time, up to 12 hours, although 3 to 4 hours is more typical. So some hallucinogen effects of tachycardia, mild hypertension, dilated pupils, anxiety, and anxiety attacks. Mushrooms, PCP, angel dust, ketamine is used out in the street and you're out of the hospital environment. And then mescaline is also used. All these called dilated pupils, increased heart rate, increased body temperature too. Ketamine will usually cause a sedative effect too. If they overdose to a toxic level, it can cause that another reality kind of effect. So treatment is usually going to be supportive, O2 therapy, of course, and monitor vital signs. Sedatives reduce anxiety. Hypnotics produce drowsiness and sleep. Barbiturates itself is a sleep aid, so our anti-anxiety drugs or your seizure control drugs. Some people try to combo these with alcohol, and it may be a tempting suicide. So drowsiness, decreased inhibition, and just staggering all over the place. They will become progressively lethargic and lower level of responsiveness until they are unresponsive. and you're just going to support these patients, possibly give up the 1 to 2 liters of normal saline, try to dilute it out as much as possible. Cardiac medications. Cardiac medications usually into some major classes: antidysrhythmics, beta blockers, calcium channel blockers, cardiac glycosides, and angiotensin converting enzyme inhibitors. And some of these patients do take a combination of all of these. So you may see all these signs and symptoms or signs of overdose with these patients. Get your hypo to IV access, contact medical control if possible. Give boluses if they are hypotensive to maintain their blood pressures. Erectile dysfunction medications are also out there. A lot of this is just going to be supportive care with those TCA. So maintain the airway and establish IV access. MAOIs can precipitate hypertensive crisis if taken in conjunction with foods that contain triamine. There is no antidote available and supportive care. SSRIs manage depression, and there's some signs and symptoms there: nausea, vomiting, tremors, agitation, and we're just going to do supportive care. Lithium are these patients that have a very large psychological history, so supportive care with them also. NSAIDs, a lot of times this is just long-term use of NSAIDs, so supportive care also with those. A lot of these patients are going to have some GI bleeding most of the time, also some kidney dysfunction. Salicylates are over-the-counter product companion, can cause a toxicity when taken over a time period. So there is no antagonist or antidote available. Acetaminophen is a well-tolerated drug with few side effects. The antidote should be given less than 8 hours after ingestion, and it needs to be done at the receiving facility. And all this is going to be supportive care too. Might be able to give activated charcoal to acetaminophen in the field if you have it available. All right, GHBs are frequently used with sexual assault. They produce a pronounced hypnotic effect along with inhibitions and integrated amnesia. So the treatment focuses on CNS depression and the risk associated with the patient being able to protect their airway. A lot of these are reported in the drinks at bars and local places like that, and sometimes the patients may say that they have a salty taste to them that they're not usually familiar with a particular drink. Organophosphates in insecticides, it is classified as a cholinergic agent. It does overstimulate normal bodily functions that are controlled by a parasympathetic nervous, and suicide attempts and accidental agricultural exposure can account for a considerable share of organophosphates. So anxiety and restlessness, headache, dizziness, confusion, tremors, and seizures. You're also going to use your phlegm or dumbbell mnemonic. Phlegm is salivation, sweating, lacrimation, urination, defecation, emesis, and muscle twitching, or meiosis such as pinpoint pupils. Dumbbells is diarrhea, urination, meiosis, bradycardia, emesis, lacrimation, seizure activity. So treatment, decontaminate these patients. A lot of times they're in fields, so they need to be decontaminated, clothes taken off, things like that before you put them on your unit. And supportive care, of course. Transport these patients immediately and suction immediately, and you need to get a paramedic en route. Paramedics have access, if their system allows them to door dope kits, and these kits can contain doses of atropine to help reverse those signs and symptoms. All right, CO monitoring and CO problems. So first thing we'll do is remove the patient from the exposure and high-flow to remember that these patients are port foxes are going to be incorrect. So you need to treat your patient based off of signs and symptoms. A lot of these patients are in groups sometimes when they're exposed to the displacement of oxygen in their environment. So you just have the carbon monoxide out there. So supportive care, high flow to, even though the pulse oximeters may read higher levels than what they're actually. Lead, significantly hamper intellectual development in children. With inorganic lead absorption usually occurs via the respiratory and gastrointestinal tract. So approximately 9% of the lead is stored in the teeth and bones. And the half-life is estimated to be about 30 years. So, supportive care of these patients, iron, a toxic effect exposure to the mouth. So gastrointestinal toxicity symptoms, abdominal pain, vomiting, and diarrhea, hypertension or shock, possibly vomiting blood. So a lot of these patients go in metabolic acidosis, and they just provide your supportive care. Chlorine gases, use chlorine gas compounds at home so you have that burning sensation in the eyes, the throat. Cyanide, be careful with patients that fires, autoimmune status. Also, the COX can be at fires too. So you have that respiratory component, that noisy breathing, nausea, vomiting, hypoxia. So you need to remove these patients from the areas and treat supportive care with high flow too. But also be careful with cyanide or exposures to caustics. It could have a respiratory component. It could cause swelling. Methyl alcohol is dry antifreeze products, dry gas, hydrocarbons with your household products, respiratory distress, and death. Food poisonings. Just be careful with these, especially if you have more than one person at a particular area. Usually occurs in restaurants, cafeterias. Just make sure that this ain't an intentional act. So you may have a crime scene there too. Salmonella, different things like that. Abdominal pain, nausea, vomiting, diarrhea, supportive care. You may need that. Fluid boluses. So, red tides may contaminate shellfish such as oysters, clams, and mussels, and that could be life-threatening. So be aware of that. So there's a lot of poisonous plants out there too. So try to get an idea of what they are, and call your poison control. And there's different pictures of different kinds of plants. Mistletoe and B, castor plant and C, nightshades and D, foxglove E. So here's some more poisonous plants. Poison ivy I, poison oak J. And that's the end of this chapter. For large doses of the drug are required to achieve the same effect. Withdrawal syndrome is a predictable set of signs and symptoms, usually involving altered CNS activity that occurs after the abrupt cessation of the drug or after rapidly decreasing the usual doses of a drug. Addiction is chronic disorders characterized by the compulsive use of substance, resulting in physical, psychological, or social harm to the user who continues to use the substance despite the harm. Antagonist counteracts the action of something else. A drug that is an antagonist has an affinity for a cell receptor and prevents the cell from responding to. Potentiation is an enhancement of the effect of one drug by another drug. Synergism is the action of two substances in which the total effect is greater than the sum of the independent effects of the two substances. So drugs occurs in all ages, in all social levels. Okay, drug abuse does. So don't think just because you're going to a place that you don't think this should be happening at, more likely it is happening.